Hi everyone, hopefully a quick one today on tonsillitis. So firstly, what are the tonsils? The tonsils are not just the areas we can see at the back of the throat. They are a set of lymphoid organs which are known as Waldeyer's tonsillar ring. They consist of the two pharyngeal tonsils, which are also called the adenoids, two tubal tonsils, two palatine tonsils, which most people are familiar with, and the lingual tonsils. The palatine and pharyngeal tonsils consist of lymphoepithelial tissue and are part of the immune system, serving as a first line of defence against ingested or inhaled pathogens. The palatine tonsils will be the focus of this video, as the inflammation of this area are what constitutes tonsillitis. So what is tonsillitis? Tonsillitis is an infection and inflammation of the palatine tonsils, either by viral or bacterial cause. It's important to distinguish between them to prevent overuse of antibiotics, as both can present with similar symptoms. Viral tonsillitis is the most common type, and it's usually associated with a common cold such as rhinoviruses or respiratory syncytial viruses, adenoviruses or coronavirus. These don't usually cause complications. The Epstein-Barr virus may also be the causative organism, in which case this may lead to infectious mononucleosis. This is also known as mono in the US or glandular fever in the UK. So for bacterial tonsillitis then, the causative organisms are usually Group A Streptococcus, Streptococcus pneumoniae, Moraxella catarrhalis or Staphylococcus aureus. So as mentioned, viral tonsillitis are usually associated with cold symptoms, and you'll have the sore throat, maybe even the swollen tonsils. But for bacterial tonsillitis, the symptoms are a little bit different. So we have a fever greater than 38 degrees, sore throat, enlarged tonsils, the tonsillar exudates, which means there's like the pus on the tonsils. You can see the white spots, difficulty swallowing, tender anterior cervical chain. This just means the lymph node in the anterior part of the cervical area are swollen and sensitive to touch. So anterior just means front and cervical refers to the neck. An examination of the oropharynx, or it just means the mouth and throat area, is crucial for diagnosis, and there are various ways to distinguish viral from bacterial causes. A swab is not needed, as many different pathogens inhibit the oropharynx anyway. We use the fever pain scoring system in our pharmacy. But there is also the Centaur scoring system. This will give us a severity score and the likelihood that antibiotics are needed. So what does fever pain stand for? These are the criteria that we use, and remember it's a scoring system. So the fever stands for fever during the previous 24 hours, that was above 38 degrees. Purulence or exudate. Attend rapidly within 3 days of symptom onset. So this is not a gradual decline in health. Patients will come in quite quickly after symptoms start. The I stands for severely inflamed tonsils, and you'll have the exudate on there as well. And the N is for no cough or coryza, which coryza's the rhinitis symptoms, so all the cough and the cold symptoms basically, that shouldn't be there. So we score 1.3 for each up to a maximum of 5, and the scores are on the screen there. And the percentage likelihood is how likely it is that the bacteria will be isolated if we were to test. So we would issue antibiotics if the score was 4 or 5, not below. That would be self-care measures. So what is the management strategy we have? For viral, this is self-limiting, so supportive care. So we're looking at hydration, rest, fluids, analgesia. Sucking on ice is quite good. Salt water gargles I love, and if people want to buy something, throat lozenges are okay as well. For bacterial tonsillitis then, what was just mentioned is fine, but we would also offer a 10-day course of phenoxymethyl penicillin, which is a penicillin. If the patient has a true penicillin allergy, then we can offer clarithromycin. Now, when I say true penicillin allergy, I mean a true allergy as in patient gets a rash, difficulty breathing, itchy spots or hives, wheezing, swelling of the skin, around the neck and the throat. Some patients may report a penicillin allergy if they've just not got on with them before, so a bit of sickness, diarrhoea, that sort of thing. But it's often best just to be on the safe side and just prescribe the clarithromycin just in case. Now, there may be some complications associated with tonsillitis. Simple cases of viral and bacterial tonsillitis will respond well to time, rest and medication if appropriate. However, there may be complications, so here we go. Peritonsillar abscess is also called a quinsy. This can occur in 2% of cases within 2 months. Give safety netting advice, as it can cause a risk of airway compromise. So, pus collects in the peritonsillar space behind the tonsil. Beware if the patient cannot open their mouth, have voice changes, and sometimes you'll see that uvula, which is the dangly bit at the back of the throat, that will be displaced to one side, and the voice can be muffled as well. It's more common in children 2 to 4 years old. Strep throat is caused by a group A streptococcus or Streptococcus pyogenes and can cause a rash, nausea and vomiting and body aches. You can see tiny red spots on the roof of the mouth, on the hard and the soft palate when you're examining the patient. Epiglottitis. Beware! This is a medical emergency, so straight to hospital. The epiglottis is cartilage that protects and covers the airway. If it swells, it can block the flow of air to the lungs, and this can be caused by infection. Some of the symptoms are a muffled or hoarse voice, drooling, difficulty swallowing, difficulty breathing, and due to the blockage of the air, stridor will often be apparent as well. This is a high-pitched sound when breathing in, stridor. A bit less serious now, but still not very nice. Otitis media. This is inflammation of the middle ear due to infection, and there's usually ear pain and effusion and fever. This can be treated with antibiotics if the patient's systemically unwell. When we talk about recurrent tonsillitis, we have on the screen there what would constitute as recurrent for UK guidelines. And if they are recurrent, it's maybe worth a referral to ENT or ear, nose and throat to see about a tonsillectomy. That may benefit the patient if it's, Well, thanks everyone. I'm going to stop there because my brain has just given up. But I think I did quite a good job of staying on track today. I didn't waffle on at all. Yay!